1. A 60-year-old male with a history of insulin-dependent diabetes mellitus loses consciousness during the course of dental treatment. What do you think is the most likely cause? A. A Dysonian crisis. B. Anaphylaxis. C. Hypoglycemia. D. Hypoglycemia. E. Ketoacidosis. Its option D is correct because patient is insulin-dependent diabetes mellitus and due to taking stress and anxiety, its glucose metabolism is increased, and during dental treatment patient may suffer with low level of glucose, means hypoglycemic, that leads to unconsciousness. 2. A 45-year-old female develops acute anaphylaxis following administration of amoxicillin. Which one of the following drugs would be the most appropriate first-line therapy? A. Adrenaline. B. Chlorpheniramine. C. Diazepam. D. Hydrocortisone. E. Salbutamol. Its option A is correct. Because anaphylaxis is a severe life-threatening systemic, allergic reaction with a sudden onset, that usually develops after exposure to an offending agent. Common triggers of anaphylaxis include food, Hymenoptera venom, and drugs. Anaphylaxis is a medical emergency requiring rapid recognition and prompt management. Adrenaline is the recommended first-line treatment. 3. A 4-year-old child presents with fever, gingival bleeding and extensive oral ulceration in his mouth. His medical history is unremarkable. What would be your most likely diagnosis? A. Candidal infection. B. Herpes simplex infection. C. Herpes zoster infection. D. Paramaxovirus infection. E. Recurrent ophthous ulceration. Here option B is correct. It's herpes simplex infection by herpes simplex virus type 1, which mainly cause a facial infection. Its clinical significance are fever, mouth ulceration, gingivostomatitis, and cold sores. 4. A 60-year-old male presents with unilateral facial paralysis, cutaneous lesions of external auditory matters, hearing defects, and vertigo. What would be your most likely diagnosis? A. Bell's palsy. B. Melkeson-Rosenthal syndrome. C. Moebius syndrome. D. Ramsay-Hunt syndrome. E. Trigeminal neuralgia. Its option D is correct. Ramsay-Hunt syndrome is a disease that affects cranial nerve 7 and 8. It is caused by the spread of the varicella zoster virus to facial nerves near one of your ears. As a result of this infection, the facial nerve becomes inflamed and irritated and facial paralysis is occur. Hearing loss in the affected ear occurs. Hearing loss is reported in 24.4% of affected children. 5. A 60-year-old female presents with recurrent oral and corneal ulceration. Her biopsy specimen reveals subepithelial bullae. What is your most likely diagnosis? A. Candidal infection. B. Lichen planus. C. Mucous membrane pemphigoid. D. Pemphigus vulgaris. E. Squamous cell carcinoma. Option C is correct. Mucous membrane pemphigoid. 6. A 55-year-old female presents with severe, electrical and shocking pain in her right cheek triggered by light touch. Clinical examination does not reveal any local cause. Which drug is most likely to be effective for her? A. Baclofen. B. Carbamazepine. C. Ergotamine. D. Paracetamol. E. Sumatriptan. Option B is correct. Carbamazepine. 7. Puerperal melanin pigmentation and intestinal polyps are most likely to be seen in which one of the following conditions? A. ACT therapy. B. Addison disease. C. Golden-Cold syndrome. D. Neurofibromatosis. E. Peutz-Jeghers syndrome. Option E is correct. Peutz-Jeghers syndrome. 8. Which one of the following is the least likely indication for antibiotic prophylaxis to prevent bacterial endocarditis? A. Congenital heart disease. B. Diabetes mellitus. C. Previous history of endocarditis. D. Rheumatic fever. Revalvular heart disease. Option B is correct. Diabetes mellitus. 9. A 55-year-old edentulous female presents with an erythematous patch on her palate. She wears complete dentures and has a history of insulin-dependent diabetes mellitus. You make a diagnosis of denture stomatitis. Which drug is most likely to be effective for her? A. Augmentin. B. Hydrocortisone. C. Ibuprofen. D. Miconazole. E. Phenytoin. Option D is correct. Miconazole. 10. A 35-year-old female presents with clicking in her right temporomandibular joint for the last 6 months. She does not have any pain or limitation of her mouth opening. Clinical examination does not reveal odontogenic cause. What does this condition most likely represent? A. Ankylosis of temporomandibular joint. B. Fracture of the mandibular condyle. C. Internal derangement of temporomandibular joint. D. Myofascial pain. E. Rheumatoid arthritis. Option C is correct. Internal derangement of temporomandibular joint. 11. Which one of the following conditions is least likely to be associated with immunosuppression? A. Acromegaly. B. Agammaglobulinemia. C. Anemia. D. Diabetes mellitus. C. Leukemia. Option A is correct. Acromegaly. 12. Bone pain, renal calcinosis, and giant cell jaw lesions are most likely to be seen in which one of the following disorders? A. Acromegaly. B. Fibrous dysplasia. C. Hyperparathyroidism. D. Hypothyroidism. E. Paget's disease. Let's comment this question. Answer 13. A 55-year-old female presents with a non-healing ulcer on the lateral border of her tongue. The ulcer has not responded to local measures. You suspect a squamous cell carcinoma. Which type of investigation would you perform for her? A. Excisional biopsy. B. Exfoliative cytology. C. Immunofluorescence. D. Incisional biopsy. E. Needle aspiration. Option D is correct. Incisional biopsy. 14. Which one of the following statements regarding cluster headaches is least likely to be true? A. Affects midface and circumorbital areas. B. Causes nasal stuffiness and facial flushing. C. May mimic anterior maxillary toothache. D. Mostly affects elderly females. E. Pain usually lasts for 15 to 30 minutes. Option A is correct. Pain usually lasts for 15 to 30 minutes. 15. A 45-year-old female presents with a 6 months history of recurrent mealtime swelling and pain in her right submandibular region. Clinical examination does not reveal any dental abnormality. What is the most likely cause of her symptoms? A. Lymphadenitis. B. Sialolithiasis. C. Sialomtaplasia. D. Sialorrhea. E. Xerostomia. Option B is correct. Sialolithiasis. 16. Which one of the following terms is most appropriate to describe pain occurring at the site of nerve injury? A. Analgesia. B. Anesthesia. C. Causalgia. D. Hyposthesia. E. Paresthesia. Option C is correct. Causalgia. 17. A 40-year-old gentleman with a 6 months history of trauma to his face and complains of slight burning in his temporal area accompanied by increased sweating. What is the most likely diagnosis? A. Bell's palsy. B. Cluster headache. C. Frey's syndrome. D. Postherpetic neuralgia. E. Trigeminal neuralgia. Option C is correct. Frey syndrome. 18. A 55-year-old male presents with hemorrhagic crusting of his lips following a course of antibiotic therapy. He does not have any systemic manifestations. What would be your most likely diagnosis? A. Anaphylaxis. B. Behçet's syndrome. C. Erythema multiforme. D. Lichen planus. E. Pemphigus vulgaris. Option C is correct. Erythema multiforme. 19. A 25-year-old female with a history of betel quid chewing presents severe limitation of mouth opening. Clinical examination reveals palpable white fibrotic bands in her buccal mucosa bilaterally. What would be your most likely diagnosis? A. Oral submucous fibrosis. B. Lichen planus. C. Temporomandibular joint ankylosis. D. Scleroderma. E. Verrucous carcinoma. Option A is correct. Oral submucous fibrosis. 20. Which one of the following conditions is least likely to be associated with an increased risk of oral cancer? A. Actinic chelosis. B. Erythroplakia. C. Leukodema. D. Leukoplakia. E. Plummer-Vinson syndrome. Option C is correct. Leukoedema.